My name is Charles McGregor. I'm a retired person, but who's a substitute teacher for Conwell School District. And I live in Peterborough, New Hampshire. And Andy Sanborn is my senator, and Joe Shaker Hammond is one of my representatives who testified here earlier. I want to remind the Commission and the legislature that the preamble of the United States Constitution calls for the promotion of the general welfare, and I believe that this fits in with the general welfare. Thank you very much.
Thank you, sir.
Hello, my name is John Hopwood, and I think New Hampshire should expand Medicaid coverage to serve low-income veterans who remain outside the VA healthcare system. Already more than 250,000 vets miss out on medical coverage because they live in states that refuse to expand Medicaid. I want to see that New Hampshire vets aren't simply disenfranchised. I myself am a low-income vet who uses New Hampshire Veterans Hospital. My grandfather was a World War I combat vet who served as commandant of the New Hampshire American Legion. The Legion was organized by vets to lobby for services such as the Veterans Hospital in Manchester. In the recent past, politicians permitted Manchester to decay and is no longer a full-service provider. Services reached a nadir at that time, and many vets continue to shun the Manchester VA because of what they perceive as poor service. The situation has gotten better, but we vets still have to be treated for many conditions of Boston. The situation alienates me. I believe the problems created by New Hampshire's lack of full-service hospital were created by contempt and a lack of compassion on the part of politicians. To deny veterans outside the VA system access to health care by blocking Medicaid expansion would be a similar show of contempt. It's unconscionable and it's wrong. My father, Second World War DAV, that means disabled American veteran. My father, a Second World War DAV who used the VA healthcare system, was a member of the greatest generation in which courage was a given. My fellow veterans who I meet in the VA healthcare system are men and women of courage. General George S. Patton wrote, I find that moral courage is the most valuable and the most usually absent characteristic. I call on Majority Leader Jeff Bradley and the State Senate to display moral courage and vote for Medicaid expansion. It's a matter of doing the right thing for veterans and for New Hampshire. And just like to say one quick thing about Senator Sanborn, about where people come from Medicaid. If you watch the House committee hearings on sexual harassment in the military, and this is a supported bipartisan, Senator Ayala, Congresswoman Custer, the women of New Hampshire, you'll know that women who suffer sexual harassment and abuse suffer from high levels of PTSD. My sisters in the military, we failed, and the system has failed. It was testimony, VA has failed. And I believe that Medicaid expansion will help in such a situation. Thank you very much.
Thank you, sir. Barbara Nicholson.
I'm short. Good afternoon, and I want to thank all of us for this opportunity to express opinions of the public. I think it's a wonderful thing. My name is Barbara Nicholson. I live in Easton, and is my senator, and I've known her for many years. I know she's very helpful. She helped us, and I benefited in the schools we work in because she brought in low-fat lunches and a walking club, and we all benefited from it. And I'm asking you to let her be an example, and all of you please vote for expansion of Medicare. I had a lot more to say, but I've changed it because nobody's spoken about my friends and neighbors who have health care, but are really, literally paying $2,400 a month or $1,100 a month with $2,000 deductibles and avoiding going to the doctors because they know they're going to have to pay so much. I have a grandson who just turned 26. He has nothing. He has a job, but no job to health care. And I had a cousin who waited and waited until she got to Medicare and ended up having, after waiting 3 years with no help and no tests, ended up having bowel cancer. People are making these kinds of decisions. Professional people, intelligent, educated people. So I guess I want to say, I support you accepting the funds for Medicaid. It's our money that we are paying taxes. I gladly pay my taxes, and wish everyone would realize we're all in this together, a community of New Hampshire residents. I have many friends in Germany and Canada who don't mind paying higher taxes because they get education and health care. I believe the veterans of a wealthy nation belong to the citizens of that nation. We have 33,814 in Rockingham County alone. And thank you for letting me speak.
Thank you very much.
Good afternoon. My name is Liz Kennett. I live in Berry, New Hampshire. I've been a registered nurse since 1971, and I'm a certified diabetes educator since 1976. I'm the president of United States Diabetes Educators, and I serve as the New Hampshire Advocacy Co-Chair. I'm here to express the support of the United States Diabetes Educators and the American Diabetes Association for Medicaid Expansion. In my practice as a diabetes educator, I have seen many individuals with type 1 diabetes decrease the amount of insulin that they take or skip their doses of insulin because they were unable to afford the insulin. Many of these people did not have access to health care. They tried to get their insulin to last for weeks and months beyond the time that it was supposed to. If they encountered a minor medical emergency, such as an upper respiratory infection or a urinary tract infection, they ended up in a life-threatening emergency called diabetic ketoacidosis, which not only used the resources of the emergency rooms, but also the resources of hospitals, particularly the ICUs of these hospitals. I have also seen individuals with type 2 diabetes who are uninsured, delaying medical care for things such as foot ulcers. They tried to treat it with home remedies, and quite frankly, these home remedies did not work. They lost legs. They became citizens that could no longer support themselves or contribute to New Hampshire. It is extremely important that we provide proper medical care and preventive services to our citizens of New Hampshire, particularly the poorest of the poor. The number of people with diabetes in New Hampshire is growing phenomenally. The number that we have today, which is approximately 8,000, is only the tip of the iceberg. There are many individuals out there that have pre-diabetes, which means they're coming down the pipe. In summary, proper management of diabetes is crucial, and we think it can only be achieved for our poor citizens through Medicaid expansion. Thank you very much. I also have written testimony to provide.
Thank you, Sam.
My name is Paul Draper. My background is in medical public health ethics. And currently, I am adjunct faculty at UNA's Department of Health Management and Policy, teaching, strangely enough, U.S. healthcare systems. My purpose today is to speak in favor of Medicaid expansion under the ACA from a somewhat different perspective below those that alluded to. That is, that there is a moral and ethical imperative to expand Medicaid coverage in New Hampshire. Medicaid expansion represents an unprecedented opportunity to offer access to health care to tens of thousands of vulnerable grounded seniors in our communities. It is a pragmatic and moral thing to do. Public health ethics and medical ethics share 4 key principles: beneficence to the good, no maleficence to do no harm, autonomy, respect for persons, and most importantly, justice in a societal context. A foremost tenet in public health is that of justice, and in particular, social justice. The health of the population as a whole is the concern of public health. The health of each individual, regardless of ethnicity, race, age, socioeconomic background, education, or existing disability, disability, or infirmity directly affects us all. Think of it as a public health version of mathematics chaos theory. The health of any one individual directly affects the health of all of us. There is a ripple effect. Public health recognizes an affirmative duty to care for vulnerable populations. The poor, the disabled, the frail, the elderly, children, pregnant women, mentally ill, and those denied access to care due to race or ethnicity. A question to ask ourselves is whether healthcare is morally different from other goods and services. Is it a mere commodity? Or is it something more basic that we all have a shared responsibility to see that access to healthcare is available to all? The World Health Organization's charter states that access to healthcare is a basic human right. Healthcare is special because it protects normal functioning, which then protects opportunities open to individuals. Our country has been fortunate in having leaders who recognize that healthcare is a right, not a privilege. Theodore Roosevelt advocated national health insurance in 1912. FDR in 1944 proposed a second Bill of Rights that included the right to adequate medical care and the opportunity to achieve and enjoy good health. Harry Truman supported this in 1946. LBJ's Great Society recognized the moral and ethical obligation to care for the vulnerable and elderly with the creation of Medicaid and Medicare. Richard Nixon greatly expanded Medicare and Medicaid in 1971, and Bill Clinton, of course, proposed his proposal back in 1993. Medicaid expansion is consistent with the responsibility of government. Ohio Governor Cassis, advocating for Medicaid expansion, stated that there is an obligation to co-police among us. Arizona Governor Brewer stated, while she was speaking in favor of Medicaid expansion, that he was concerned that not doing so would be a tragedy that can't be calculated.
Mr. Draper, yes, we're out of time.
Okay. Thank you very much.
Ladies and gentlemen, thank you. I put out a Facebook call to Senator Stiles' community asking for people who have stories to share. Surprisingly, a neighbor of mine at Westside Exeter responded, and this is her story. Just wanted to say that it's not just low-income people who have a difficult time maintaining adequate health insurance. This issue affects many people with chronic illnesses as well as the elderly. I'll share with you a story. My daughter Kelly is 32. She was diagnosed with end-stage renal failure in 2003 as she was in her final year at community college. She receives SSI, but as stated, she was 22 and the kidney school, was only working part-time and going to school. Her monthly benefits based on her earnings are very small and will not allow her to live on her own. She has a number of health issues that prevent her from maintaining a job. She goes to dialysis treatment 3 times a week and is in and out of the hospital with many other health issues. I'm fortunate that I have a great job and I'm able to keep her on my insurance through my employer. The insurance provides us with very good coverage. She also has to maintain Medicare A, B, and D. There are special rules for patients with end-stage renal failure. After 36 months, my insurance became secondary and Medicare became primary insurance. At the time, I was not aware of this rule and had dropped the Medicare. Why should I pay for additional coverage if I had good insurance policy through my employer? After learning about the rule, it was difficult finding our way through the system to get the coverage she needed. Affordable health care is one of our biggest issues facing this country, regardless of any events with Blanchard, West Side of Rochester. Thank you.
Thank you, Mr. Moyer. Barbara Power and Mark Robinson.
Hello, my name is Barbara Power. Thank you, members of the Commission, for your attention to our stories today. I work as a nurse in the front lines of healthcare delivery in New Hampshire. I would like to give my perspective as a nurse and as a New Hampshire citizen for the past 37 years. For those in this room and on this commission who are healthy, please count your blessings. The numbers have been presented. The fiscal impact has been analyzed and vetted. There are important conclusions to be made if New Hampshire does not accept the federal funds to expand Medicaid. I've eliminated things that have already been said. I will add public health in New Hampshire will be adversely affected as long as our adult population is hindered by lack of health care. This is a fact. It impacts the lives of thousands of ordinary Granite Staters and will eventually affect all of us. I can testify to the fact that adults in New Hampshire are struggling and Medicaid expansion to help them meet their essential health care needs. We in healthcare see trauma cases with no resources for follow-up, cancer going undetected, serious infections going untreated. In one of New Hampshire's large cities, I once took care of a young adult construction worker who had decided that suicide was a better option than the anguish he was enduring while trying to obtain insulin for treatment of juvenile diabetes. He had no insurance and no hope. He was a productive worker trying every day to survive. We had no viable options for this young man in the future of his health care in New Hampshire. Medicaid expansion would have given him the coverage he needed to change the dreadful trajectory of his life in New Hampshire. He is one of thousands. New Hampshire has an opportunity to take advantage of considerable federal funding for Medicaid expansion. It is logically false to put our citizenry and our economy at risk by not doing so. Please accept the federal funds to expand Medicaid. I appreciate, after living here for nearly 4 decades, our stoic, live free or die motto in New Hampshire, but I do not know anyone of any stripe in the 21st century who does not understand that health is key to living free. Thank you.
Thank you very much.
Mr. Chairman, Commission.
Mark
My
Robinson.
name is Mark Robinson. Currently, I'm the president of TakePets.com, a company that makes, among other things, wheelchairs for dogs. I've had several businesses in the past, and I currently employ 15 people in Amherst, New Hampshire. I've been paying 75% of their health insurance premiums for some time now, and I really appreciate the tax benefit I got in 2010. But even so, some of my employees still can't afford the premiums and remain uninsured. I'm hoping to get some relief from the SHOP program in October. I need my team to be healthy. Every person needs health care to survive. As a society, we always pay for everyone's health care, directly or indirectly, whether through taxes, inflated insurance premiums, or other means. Hospitals don't turn people away, and we don't want them to. As I understand it, the purpose of the ACA is to lower the national health care costs by putting the health care costs of being insured into a managed system, rather than funding them outside the system as we do now. Just as uninsured motorists drive up New Hampshire auto insurance costs, I'm hoping that everyone in New Hampshire will be able to afford health insurance. It seems to me that the people who are against this Medicaid expansion are generally people who oppose the Affordable Care Act. It looks to me like an attempt to weaken the act. Because without Medicaid expansion, the ACA is really limited. Because people who make under the federal poverty level will be left without insurance. In that we as a society are not going to deny them hospital care, the cost of their care goes back into this unmanaged public pool, and their care, of course, is more expensive because it's emergency related rather than preventative PCP care. The arguments that we can't afford it and it is not funded just don't make sense to me, because we're paying for this now, and we'll continue paying for it in the same inefficient, overpriced manner if we don't elect to accept Medicaid expansion.
My name is Ryan Kelly, and I live here in Concord. When I graduated from college with my bachelor's degree, I began purchasing health insurance as an individual. And in just a couple of years, despite being in the prime of my health, the cost of insurance continued to increase. And with my student loans, I can no longer afford to buy health insurance on my own. And I remain insured to this day. With that, since I graduated high school, I've never been without a job. first job was at Canadians, owned by Senator Sanborn, and health insurance was not provided. After that, I coached at Colby College as the assistant Northern Ski coach, and their health insurance was not provided. Because of this, after coaching about 3 years, I returned to Concord to settle down, pay my bills, and figure out how to get health insurance. Since then, I've worked not one, but 3 jobs. I've helped some of you here at the YMCA, where I work as a trainer. I've made a coffee at True Brew Barista, and I may have had the pleasure of coaching some of your kids at Bow High School, either cross-country running, track, or Nordic skiing. And I've helped many of them become champions. But I still have no health insurance. On top of my 3 jobs, I compete as a professional triathlete, a profession that certainly does not always end up in a paycheck. And so I started the New Hampshire Multi-Sport Project to help young athletes pursue their dreams and give back to the community that has helped support me, except in health insurance. So please do write other residents of New Hampshire, most of whom work hard every day, like myself. Please support Medicaid Expansion. Thank you.
We are also parents, grandparents, spouses, daughters, sons, friends, and neighbors. It is in our wholeness, the full breadth of who we are as people, that we committed more than 10 years ago to pursue health care for all. Some of you may recall New Hampshire Health Care and that was our project. We worked very hard for years just to get to this place that we are at today, fighting for everyone to have access to affordable quality health care. We did this guided by our moral compass, because health care should not be used as a commodity or merely a financial equation or a budget item. There are too many people in our lives that we love that cannot afford commercial health care. We know the risks that they face each and every day and the likely outcome of these risks that they will experience without health care. There is no reason good enough, not in our minds, no reason good enough to turn our backs on these people. We are all connected to each other. Their pain and suffering is ours. We love these people, our children, our grandchildren, our brothers and sisters, our fathers and mothers, our best friends and our neighbors. Medicaid expansion fills the gap in the new spectrum that we have through the Affordable Care Act. The federal government is standing up for these people, for our loved ones. Please endorse and support Medicaid expansion. Please allow the people of New Hampshire to stand up for the rest of us as well. And to correct the record, there are 4,000 state employees that do not have access to health insurance right now. Mr. Cohen reported that earlier. There are over 4,000 part-time workers, and there are thousands more than our government workers in county, municipal, and private sector. I'm going to show a picture. This little baby deserves parents that have insurance. This little boy deserves his daddy with insurance, and they don't have it. Who's going to take care of them when they get too sick to take care of these kids? Thank you.
Thank you, Ms. Lacy.
Good afternoon, Mr. Chair and members of the Commission who have sustained this long, hot afternoon. Thank you very much for the opportunity to join the myriad other voices that you have heard as we try to advocate for the expansion of Medicaid. I am the Reverend Dr. Mary Westfall. I'm the Senior Minister of the Community Church of Durham, UCC, in Durham, New Hampshire, and I rise to speak on behalf of God. No, I'm just kidding. I was actually seeing if you were still awake. That would be very presumptuous. No, I rise today as the chair of the Commission for Witness in Action of the New Hampshire Conference United Church of Christ. As you heard from one of my colleagues, the New Hampshire United Church of Christ is the largest Protestant denomination in the state, and we represent many congregations throughout the state who are working very hard to care for the most vulnerable and the often forgotten in our state. As a person of conscience and as a religious leader, I believe that affordable health care is part of the moral and social compact we make with each other in a democratic society. and is an essential part of providing people access to their full rights and the possibility of pursuit of happiness. As far back as the mid-1960s, the Reverend Dr. Martin Luther King Jr. observed that of all, and quote, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane, end quote. Surely any of us who have ever faced health challenges that we would never have been able to pay for ourselves can wholeheartedly agree with this sentiment. But perhaps even more shocking than the situation King spoke to then is that now 50 years later, we are still plagued by such unconscionable injustice. To live without affordable care makes the underinsured a great risk to themselves and others, something you have already heard here today. In our tradition and many spiritual traditions, the bottom line is, do unto others as you would want done to yourself. I am grateful that I and my family members have insurance, and I hope that my neighbors, those who are uninsured, could also experience the benefits from this great state through the expansion of Medicaid. Thank you very much.
Thank you for your comments.
Good afternoon. My name is Shalina Batten. I'm 26 years old, and I'm a proud New Hampshire resident. I work part-time in a local flower shop at 15 hours a week, bringing home $450 a month after taxes. I'm a full-time online college student maintaining a GPA of 3.8. I'm receiving financial aid to get myself through college. Why I need money? I am considered a low-income applicant that doesn't have access to affordable health care. Even if I could afford health insurance, many health insurance companies turn me down to my substandard chronic disease. With only bringing home $450 a month, I just barely afford my bills, fuel for my vehicle, and food to provide myself. In 2004, I was diagnosed with Crohn's colitis disease and inflammatory bowel disease. Due to this disease, I was very sick. Fact, near death. Because of this disease, my large intestine ruptured inside my body, leaving me at death's door. Thankfully, I survived. Since 2004, I have lived a diverse lifestyle with an ileostomy. This calls for medical supplies. The last 4 years, Key Medical has provided me with free medical supplies until recently. They made me aware I was shut off from their free medical supplies. Reality hit. I'm going to have to pay out of pocket for these expensive medical supplies that are a necessity for my lifestyle. These products can cost over $200 a month. This alone will take most of my income. 6 months after I graduate next year, I will be billed for financial aid loans. Both of these expenses will take almost all of my monthly income, leaving me with no money for bills and no money for everyday cost of living. I need medical coverage. I can't do it on my own. So Commission, please expand Medicaid for individuals like me. I do not want to have to relocate to another state. New Hampshire is my home. Thank you.
Thank you.
Good afternoon. Thank you for this opportunity to speak. My name is Karen White. I'm from local shop in New Hampshire, and I am the mother of a 6-year-old who experiences autism. And today I'm going to talk about a paraprofessional, Ashley. Ashley is an amazing paraprofessional. She gives all her heart and soul to my son. And she is his ambassador for an inclusive life. She really is. This morning she went on a job interview. Not with me. She went on a job interview with a factory. Why should she do that? Because my job and the 2 other jobs that she had at home cannot provide her with health care. This past summer, she encountered an autoimmune disease that has made it almost impossible for her to pay for these bills herself. She had a very frank discussion with me. She's like, I'm looking at filing for bankruptcy at 21. This is not somebody who sits down. This is somebody who is standing up and trying to better herself. You know, when I look at the expansion, it seems very clear to me. We're paying taxes that's going to the general pool of the federal government. We're going to take back a little bit of that money. Even if we deny this expansion, we're still going to be paying. we're still going to pay to the general pool, and other states who accept it wouldn't get their money. I implore you to please take care of our hard-working individuals who just can't afford health care. Thank you so much.
Thank you, Ms. Kane.
Hello, my name is Carol Penny, and I'm from London. My name is very much for allowing me to speak. It is very difficult to be here. My son, we lost our son for example, my son lost himself through addiction. I had to watch that process. It just is unbelievable. I watched my son lose himself from incarceration. They take their hearts and make them cold. There is no help in incarceration. Some people may seem to think so. My son hasn't done anything. Not even an AA meeting has not. He received 1 to 15-year prison sentence for receiving stolen property. That sentence is becoming a life sentence. He has spent most of that time already in prison. The prison system has spent close to $500,000 on my one person. My family has spent over $100,000 to try to save him. He is still in the interstate prison. The last time he got out, he tried to get counseling through Manchester Counseling Services, and he was denied. He was denied because he was only an addict. New Hampshire does not cover addiction. But the irony of it all is they play pool money for addiction through their prison system. 90% of the recidivism comes through addiction. The amount of money that New Hampshire has spent on my son alone, how much more are they spending? So I can't buy that New Hampshire can't afford coverage for health, mental health. With the gun laws now, we need even more than we did before. We have to protect our citizens, and we're not helping when we refuse to help them. I beg you, don't spend any more money on incarceration. It's throwing money away. You have the power to put this money in good hands. And not only your money, but the government's money. How can we lose? New Hampshire has neglected addiction. Please, don't neglect it now. Thank you.
Thank you, Ms. Kane.
Person who comes to the commission that you can say your testimony. I'm a newly licensed registered nurse. I started nursing school in 2011, and that was the year that Southern New Hampshire Medical Center closed 30 mental health beds. We began our clinicals in January of 2012 as our teachers scrambled to find clinical placements for 32 individuals to try to get some real-life experience in care of people with mental health issues. So I found myself driving 2 nights a week to this New Hampshire State Hospital because I had the opportunity to work there. And that's where I saw how it is that these cuts to mental health is being funded and is being carried by the hospitals, by the community mental health system, by service providers. When I worked at New Hampshire State Hospital, I worked on a unit, and it was a mirror image unit directly in back of it. My unit was occupied by patients, the one in back of me was empty. So when we asked the people who were providing care why it is that that unit was empty, because it was well appointed, it was a really nice unit, they said, well, there isn't enough staff. And at that time, there was a waiting list for mental health beds in the state of New Hampshire. People were going to emergency rooms and staying there for days. People were in waiting rooms in the community mental health system with the centers waiting for rooms, and there was no way to go. I've had people with mental illness say to me, I won't report my suicidality because I'll just wait in the ER, and there's no hope for me there. It will only exacerbate the symptoms. That's what it looks like in my life. And I wanted to tell you that because we expect to get psychiatric nurses in the future. We've got to have clinical placements for them now. How many beds for people need? Thank you for expanding my medication.
Thank you for your comments.
I would urge the commission legislation.
Talking to the mic.
They do, yeah. Speak into the mic.
No matter what you do in the end, adhere to the Constitution and provide freedom of choice in what participants are going to be able to do. And providers, insurance companies, all should be, the door should be open. Our medical system is suffering under government regulation. We're not getting a healthcare system that was intended by the original Constitution of the state of New Hampshire or our federal Constitution. What we have experienced is one abuse after the next. Our doctors and healthcare providers in general, should they be considered as second-class citizens? That they would be basically nailed to the wall by the, quote, officers of the court, and that would be the lawyers, suing them to no end so that they have to practice defensively. No, that's not freedom. We haven't had true freedom in healthcare for decades. And it's an agenda, and that's what we have to recognize. I believe this is the camel's nose under the tent. And I think that Anthem Blue Cross is the equivalent of Freddie Mac and Fannie Mae. Whether or not they're technically tied to the government, they knew that they could push the buttons no matter how many bills they ran up recklessly in charging hospitals that were working in compliance with them. They knew that they could push the government buttons to get those bills paid. Other insurers were not quite so sure and they suffered. And so now, atrociously, we have, if I heard correctly, one provider in the state of New Hampshire. That's a disgrace, an absolute disgrace. And the young people would be forced into the hands of this camel, so to speak, and pay one premium, or maybe two, whatever the limited number is not correct according to the Constitution. Article 83, Part 2. It is the inherent and the essential right of the citizens of the state of New Hampshire to enjoy the benefits of free and fair competition in the trades and industries. And that, of course, includes the healthcare industry. It's a sad note that we've allowed this to happen. But what the duty of the Commission, I believe, and the legislature would be to try to work things out so those young people in the future will be able to enjoy the same benefits as our forefathers enjoyed. And that was a real competition. And America, in general, led the world. And we're living off the momentum of that, gift of freedom that built up the healthcare industry unmatched in the world. Thank you.
Thank you very much for your comments.
Medicaid is crushing burden in most states. Debt is exploding at city, state, and federal levels. Pension costs in many states are unaffordable. This really has to stop. Our federal government has over $17 trillion in debt. The federal government borrows about 40% of what it spends. Medicaid expansion supporters say the feds will pay New Hampshire 100% of Medicaid expenses for the first 3 years and 90% thereafter. In view of the federal debt and annual deficits, this is an empty promise. Further, we are both New Hampshire and federal taxpayers. Further expenses should be rejected. Thank you.
Thank you very much for your comments, Mr. Pearson. Are there other individuals? Thumbs up. Are there any individuals present who were unable to sign in? would remind our commissioners that if there are questions related to any part of this discussion, or particularly the further on the panels, please send them to me, and I'll be glad to get them to the names when we can for response, either in writing or at a future time in our meeting. Yes, ma'am. In the back, if you want, there is a large sheet that gives you an email or the website to send. We appreciate those by the end of this week. So you can write. That'll be fine. All right. I have only one item of business. I have entered into the meeting in minutes. So the minutes from our previous meeting, is there a motion to accept the minutes of the last meeting? Is there a second? Discussion? All in favor, say aye. Opposed? Thank you. The minutes passed. So again, for those of you who are here, we appreciate everyone's patience, your efforts to participate. We would provide this commission with help and information perspectives. Again, thank you very much. And